Hello, everyone. My name is Megan Garrett. Thank you for coming to my presentation today. And today we will learn how to communicate effectively with female patients as healthcare providers. So, considering the fact that the United States population is just over 50% female, it's very fair to say that you will likely come into contact with a female patient at some point during your career in healthcare. Therefore, it is important to ensure that we are interacting with female patients in a manner that provides them with exceptional health care, because every patient has the right to effective and competent health care. Therefore, it is important to understand the female as she exists in United States society and how we best meet her needs. So in order to ensure that that happens, there's a few things that need to happen. Of course, we need to meet her basic needs first. We need to provide a safe space. We need to listen, and we also need to teach back or have her teach back. And as the healthcare provider, you are the liaison between the females receiving care that's effective and providing what they need in order to ensure that they receive effective healthcare. So we'll jump right into it. We should encourage preventative care. Preventative care is important because in order for us as healthcare providers to provide care, patients have to seek out care in the first place. This says daughters, as a study listed by Wallace says that daughters who care for their older parents are more likely to have lower incomes than non-caregivers and are further penalized with even lower financial resources as they age, from 2018. So this is saying that female patients are less likely to have access to financial resources in order to pay for healthcare. So we need to ensure that we are letting them know about resources that are provided by the government, such as WIC or SNAP or financial resources or insurance cards or discount codes that can be provided through places like GoodRx that can help them to receive healthcare that is cost effective to them. If they don't seek healthcare in the first place, we will never have the opportunity to help them receive good healthcare. So routine checkups are better in the grand scheme of health, as it reduces the likelihood that abnormalities will be caught before they progress into bigger problems. So therefore, we need to communicate and share with women the importance of encouraging preventative health care. Secondly, we need to emphasize the importance of having a personal advocate. And what I mean by that is having a support person, either a friend or a family member, who is available to come to appointments with women, or with anyone really, but this presentation is about women. It's important to have someone else who can listen to what the doctor or other healthcare provider is saying, and then they can have yet another resource in order to go to with their questions or with understanding things maybe in a different way, or explaining things in a different way, since they actually know this person on a personal level. And as women age, it's important to note that women are less likely to have advocates in their corner. It was actually found that in every racial ethnic group, women are substantially more likely to live alone rather than men. This was even further emphasized when we were talking about lesbian women. And this places them at a disadvantage. They should be able to bounce their care off of somebody that they know and trust, and know that somebody else is in their corner supporting them and has their best interests at heart. So, and it also is important to assess the patient's condition, which goes into meet their basic needs first, which is listed on the bottom for the healthcare provider's role. If somebody is in pain or distraught, they're less likely to understand the information that's being taught to them. So we need to make sure that their basic needs are met. They have access to water, they have access to a restroom, they're not in pain, they're not anxious, so that they can take in the information that we're giving them comfortably and easily. We also need to provide a safe space for patients. this is really important because if you don't feel safe, or even safety doesn't have to go with just physically safe, but if you feel like you're going to be judged or you're going to be treated unfairly, then you're not going to want to open up to your healthcare provider. So it's our role to ensure that we are providing a safe space for our patients. Lastly, we want to ensure that we are listening to our patients. It's so easy to get on a roll with talking and blabbing your mouth and trying to get out of the room so you can go on to the next one. But if you're not adequately addressing the situation because you're failing to listen to your patient, then your patient's just going to come back and you're going to have to spend more time with them now that you could have been helping somebody else had you effectively helped them in the first place. So this is also why it's really important to illustrate the teach-back method. This ensures that your patient heard what you said and is able to articulate it in their own words. So this shows that they are adequately listening to you. And this is important to mention because another study in 2018 by Stans et al. States that both clients and professionals appreciated the benefits of preparing the conversation, ensuring a suitable environment, giving clients enough time, and using nonverbal communication and tailoring communication to the client, which all goes back to assessing the client's condition at first. So all in all, you can see that you are a very important liaison between delivering effective healthcare and between ensuring that the patient has everything that they need in order to receive that care. Thank you so much for coming to my presentation for communicating with female patients for healthcare providers. And I wish you all the success and joy in your healthcare careers. My name is Megan Garrett, and thank you so much.